What's going on, everyone? It's Derek with OPTP, and I am joined today by Dr. Deb Riczo, who's a brilliant mind. And today we're going to go over kind of the top two questions, or two of the top questions regarding back and pelvic girdle pain for pregnancy and postpartum. We're going to start with a question that I think you get asked pretty commonly is, what can I do to decrease the risk of developing back and pelvic girdle pain?
That is a very common question, because we all know that there's a lot of problems with back pain and pelvic girdle pain during pregnancy. And so much so that people, doctors often don't even refer to physical therapists, and they just tell the women that it will go away. But unfortunately, they're not living in that body that's hurting. So there are things you can do. And of course, it's going to vary per individual. It really depends on the individual what's going to have a resonance to you. But these are some of the factors that I have found are very important during my research and my clinical practice. So first of all, having a good strength and flexibility program when you're pregnant and when you're postpartum. So that is there's a lot of information in my book regarding that, and how you can safely make modifications during pregnancy and during postpartum, because it's going to depend on what kind of delivery you had and any complications and things like that. You want to, in general, stay active. So these are choices that we make, right? Staying active is very important because we're moving, and our muscles are designed to move and not be sedentary. So that's helpful for our circulation and for our strength in general. You want to have a healthy lifestyle. So you can see where I'm going with this, that it's a holistic approach. It's not just one thing that's going to help decrease your risk, but having a healthy lifestyle. So if you know that you're not being that healthy right now, during pregnancy and postpartum is really a good time to turn over some new leaves. Nutrition, good nutrition, sleep habits, which of course is more difficult and challenging during this time period, decreasing stressors in your life, things like that. So having a healthy lifestyle and making healthy choices is very important. Also, what shoes are you wearing? You know, it's fashionable to be going around in flip-flops and barefoot and things like that, but I would not recommend that during pregnancy because it does, when you're walking, have that stress go all the way up the chain into your pelvis as well. What kind of bra are you wearing? You want to have something with support, and then maternity support or a sacroiliac belt, which you can find on OPTP. And that can be very helpful, especially in that third trimester. Posture changes during pregnancy and during postpartum because of the change in your muscle length and flexibility and strength. And the weight distribution, I'm going to be giving a couple tips at the end regarding posture and body mechanics. That is how you move. So if you are always bending improperly, for example, that's putting stressors on your back. So knowing how to bend, move, carry, lift, and those things I do also cover in my book. Another tip would be like avoid one-sided activities, standing on one leg, sleeping only on one side, things like that. And again, I cover these in my book. And also job stressors. What kind of job do you have? Is your job causing more stress to your body, which is changing now? You may need to talk to your doctor regarding getting some work restrictions if you feel that is something that can be a problem for you. That would be another recommendation I would do. And also returning to work too early if you have a stressful job. That's, again, another conversation with your healthcare provider.
Yeah, thanks, Deb. That's great. The next question, or one of the most commonly asked questions, is, what are some of the things people can do at home to minimize the risk of developing some of these pains?
Well, I often get asked, like, what are some of the exercises? And of course, my book is filled with exercises, but a basic exercise is called activating your core. And that I'm going to go through right now. So what you wanted, and your deep core. which is your pelvic floor, your transversus abdominis, your deep low back muscles, the multifidi, and your diaphragm. So we're going to take a deep breath in. You should feel your rib cage expanding, your belly relaxing, and then exhale through pursed lips, feeling tensioning in your lower abdominals. And let's try that one more time. Deep breath in, belly relaxing, rib cage expanding, and exhaling all that air out through pursed lips or with a hiss. As you're doing that, you're trying to engage your pelvic floor, lift it up, pull the belly muscles in as if you are zipping up a zipper of tight jeans. Okay, and we're going to do that one more time. Deep breath in, blow out, pelvic floor lifts, zipping up that zipper, tensioning those abdominals. So that is activating your deep core. And that is crucial to the exercises that are in my book. And the second one I wanted to talk about is the pelvic tilt. And you may be very familiar with that. And if you're not, I'm going to go through that. So when you are standing, your pelvis moves forward and it moves back. And that's called the pelvic tilt. During pregnancy and even afterwards, postpartum, because of the lengthening of the abdominal muscles, there's more of a tendency to stand with our pelvis tipped forward, and that causes a lot of stress in our back. So the pelvic tilt is just moving this way. Now, if we add the core, engaging our core with that, we're going to take a deep breath in, blow out, and tilt. And inhale, relax, and then exhale, tilt. This is a great exercise because it loosens up the back and it engages your core. And you can do it in a number of different positions. You can do it in standing. You can do it in sitting. Okay. You can do it on your side and you can do it on hands and knees.
Okay, Dr. Deb, thanks so much for sharing those exercises with us. I know as we wrap things up here, people are probably wanting more. And so I want to direct everyone, first of all, to OPTP's website so that they can check out your book, Back and Pelvic Girdle Pain in Pregnancy and Postpartum. If you are pregnant or postpartum, or you're soon to be pregnant, this is a wonderful resource. But Dr. Deb, just real quick, you also have another book. If you could quickly mention that publication as well, because I think a lot of people who are watching this video would also benefit from that.
Yes, that book is called Sacroiliac Pain, and it focuses on the same method that is in the pregnancy book, the pelvic girdle musculoskeletal method, and will walk someone through who is having problems step by step.
Perfect. Okay, well, if you are watching this video, to our viewers, during Pelvic Health Week of our Summer of Savings event, you can save on Dr. Deb's books as well. So make sure you click on the OPTP website and check that opportunity out as well. Dr. Deb, one other thing I wanted to make sure we noted before we step out here, you're active on social media, Facebook, Instagram, even LinkedIn, but particularly Instagram is somewhere, a channel that's been growing for you. You put out a lot of great information every day. If you want to tell people about that real quick.
Well, thank you. Yes, my handle is Riczo Health Education. My last name, it's spelled R-I-C like in cat, Z like in zebra, O, Health Education. I post daily. It's a holistic approach, and I post exercises, and I think that you'll get a lot of benefit. I also offer a free discovery 15-minute call that there'll be a link in the bio on Instagram for that.
Perfect. Yeah, we urge people who are struggling to take advantage of that. But thank you so much, Dr. Deb, for your time. Thank you everyone for watching. And we hope this video brought some value to you. We'll see you next time. Thanks.